Hello and welcome to episode 57 of Tom's Hirschsprung's podcast. I have Sherry with me today, and we're going to talk about, we're going to talk about Hirschsprungs, we're going to talk about your story and various medical studies you've been involved in as well. So it should be a very interesting story to be told. And welcome to the podcast, Sherry.
Hi, thank you for having me. I'm looking forward to it.
Me too. Me too. It should be a very interesting one. Um, we'll start, if I may, sort of from the very beginning, because you were operated on by a very famous doctor in Dr. Everett Koop.
Yes.
Would you like to just sort of explain a little bit about him?
Well, first of all, we got to him because my surgeon in Elkton, Maryland, which is between, if you looked on a map, between Baltimore and Philadelphia. And my surgeon had gone to medical school with C Everett Koop. And when he was just a general surgeon. And when he really didn't feel like he could treat me, and they were deciding where to send me because there were a lot of options in the northeast of the United States, he said, I went to school with C. Everett Koop, and he's one of the very few pediatric surgeons. So my mom just took his advice, and Dr. Fisher called him, and that's how we got to Philadelphia Children's Hospital. Now, the one thing that I want to say about C. Everett Koop is he was really sweet to my mother. My parents got married very young. My mom was 16. I was her oldest. She had turned 19 2 weeks before I was born. So, very young mother. And when she had me in Elkton, they were in a hospital a couple days. And then that's when it all started. But he was really sweet to her. He really explained things in ways she didn't that she understood. He drew her pictures. And one of the things he said after he got done examining, he came out and he says, Mrs. Privet, there's two kinds of babies that come to this hospital, babies that are going to die and babies we can help. And I can help your baby. That was huge for my mother. And he took her every step of the way, even before they did the colostomy surgery. He took her in and showed her babies with colostomy so she wouldn't be surprised when I came out.
Oh, wow.
Yeah, I mean, he just really did things back then that was not done. Like, I was in a semi-private room with 50 children. 50 babies was a semi-private room in 1964. So, and then I know that he took apart Siamese twins that were connected all through from the chest down to the abdomen. And then later on, he became our Surgeon General in the 80s.
Yep. He was
He lived a long life. And I know that he really did a lot in the pediatric world long before that was a thing. And a nice little story here. He told my mom in 1964 that one day the insurance companies were going to run medicine.
So not only was he a pioneer, but also a visionary as well.
Yes,
Wow.
he's because my mom said that to me a couple years ago. Dr. Cook told me this is where medicine was heading. My mom just always felt like he was a really good man and he could be trusted.
Yeah,
So he was very, very good to the parent of the patient.
absolutely. And I mean, he was, I guess, in the research I did on him as well, that anyone can sort of find out. He was a pioneer in a lot of different ways as well. It wasn't just in children's hospitals, in sort of children's wards and in operations. He was sort of very much against things like tobacco and smoking. And
Very early.
much earlier, 1988, I've got it down here. Back sort of when again we probably didn't know as much as we know now when it comes to tobacco and smoking. I saw that in his particular I don't want to call it constituency hospital. He got smoking rates down from 37% to 28%. which again in those times would have been enormous.
Yes, yes, yes. Because definitely, I definitely grew up and smoking was just everywhere.
Yeah, yeah.
Kids today don't understand how prevalent it was. I mean, you just smoked everywhere. You smoked in the hospital.
That sounds crazy nowadays.
You
That's
smoked on an airplane.
Yeah. Well, I mean, I think I'm old enough to remember, smoking in restaurants, and that
Yeah.
sort of, I think I can't remember when that was outlawed here. It might have been 2005. I'm guessing. I don't know. Um, but around that
Yeah, the
time.
separate room never really worked in the restaurant.
No, no. People sort of forgot that smoke actually travels through the air. It doesn't just stop when it sees a stop sign and goes, "Oh, actually, no, I won't travel across there." It doesn't work like that.
And then C Everett Koop was the first surgeon that did the pull through on infants. When I was young, the pull through was being done on 2 and 3 year olds, toddlers. So I don't remember any of that at all. My first memory is hiding from my mom so I didn't have to have a suppository. Well, that's my first memory.
Well, yeah, that's what a first memory to have. But, but yeah, I mean, it just sounds like the most amazing man. Just somebody who sounds like way ahead of his time, I guess.
Yes, yes. And a good man, just a good man.
But that must have been incredibly comforting for your parents to have somebody there who not only was, very intelligent, but also would be so adaptable and be able to sort of talk to everybody in a way that made them feel comfortable.
Yeah. And he didn't back then they like I don't know what surgery I had. I know that the surgery that they did before mine left male children impotent. My surgery had only been done being done a couple years.
Wow.
My mom knew that, but they didn't give you the names. They didn't tell you whether it was long or short sec. None of them terms were used with my mom at all.
No. But again, that we're
What they
talking about.
told them is what they were going to do and how they were going to fix her baby. And that was all she cared about.
I guess that is at the time. That is all at the time. That's all you do care about. But we were talking
Yes,
about in terms of long and short segment, because you're unsure as to which one you have.
correct.
I know we were started talking off air about how that sort of came to be, um, but I guess for everybody listening, how are you unsure?
Because that wasn't something that they talked about at all then. So all I know is how much they took out between 10 and 12 inches of my colon. And that's the only words my mom heard. They didn't use any of the medical terms with her. They really wanted her to understand in layman's terms what they were doing for me.
Yeah, definitely. That's
And
but
I
that
don't, and back then, I don't think the doctors gave the patient as much information as they do today.
no,
Back then, you went to the doctor and you just did what the doctor said. You didn't question the doctor. You didn't assume that you could have a bad doctor.
no.
You just trusted your doctor.
Yeah,
I know
what
it's
they
a
say.
concept today, but it was what it was back then.
Yeah, I guess what they say goes back then. It was just a case of my doctor said this. That's what I'm doing.
Yes.
Wow.
Yeah.
Whereas nowadays we're potentially. I mean, there's still a lot of that, and a lot of very, very, very good doctors out there, and we just do and take whatever pills they give us and do whatever they say. But there's a lot more, I guess, information around as well because we're obviously talking pre-internet days here, very
Well,
much pre-internet
I
days.
went to the library to look stuff up.
There will be people probably
My daughter never had that joy.
not when you've got a smartphone now.
Well, she started on the computer. She's 27. So they weren't quite smart yet. They just were phones.
But definitely internet being around there as well. 19.
I knew when I had her, she had to have computer literacy early.
Yeah,
There wasn't an option in today's world. I knew where it was heading. I had her on it too with Disney and Sesame Street apps, software.
yeah,
So that's where I knew we had to go.
absolutely. And then we were talking as well a little bit about Mayo Clinic as well, which is something I have heard of. And you're very um, positive about how they've treated you. Would you like to talk a little bit about them?
Yes. I had, let me start with prior to COVID.
Yeah.
Well, let's go way back. I've been going to Mayo Clinic. Oh, I must have been my late 20s. And I went up there for several things. I've gone up there for several things throughout the years. But one time I was up there and I was going through fertility stuff, and somebody come up along the way and said, "Well, we've got a constipation study going. Would you be interested in coming back? And we'd like to do this study on you because I think we might learn something, maybe a little bit more about how your colon works." And they kind of told me what the study was, and I kind of did it, and not joyously because it wasn't a fun study. So I spent 2 full days doing cleanse. You think a colonoscopy cleanse is difficult? Yeah, do the other one. It's even worse. 2 days of cleanse in hotels with not good toilet paper.
Oh no.
Yeah. And then they put tubes up your rear end, not tube wires. So what they were doing for me is it was an 8-hour test, 4 hours totally on an empty colon and 4 hours on a full colon. So after 4 hours, they gave me a 3,500 calorie shake and I had 20 minutes to get it down,
Okay.
which is, a lot of calories. So they're wanting that colon to go to work. And so the next day I go in and there's 20 doctors in a little bitty exam room at Mayo Clinic that sees everything, everything in the world that they see. And the doctor looks at me, he says, we kind of thought when we did this that when we got in there, you were just going to have maybe kind of a sluggish gut. Things were just going to work kind of slow. He says, but you know what we found? When the colon is empty, you have perfect nerve and muscle activity. When it's full, it does not function properly.
Hmm. That's
Yeah, right. I
hmm.
believe that's changed the direction of some of the research in Hirschsprungs. I'm not saying it's discounting the DNA stuff because that's how you get it, but I think it definitely could affect how it's treated.
Yeah, that would be a really and what year roughly was this?
I think I was in my mid to late 30s, so 20 some plus years ago.
So
When I went back a couple years later for something, I says to him, "So, did you publish that paper in Gastrology Today?" I don't know what gastrology magazines they have or doctors' journals. That was my joke, and they're like, "Did they tell you they were writing a paper on you?" I says, "No, but when you have 20 doctors staring at you in a little doctor's office at Mayo Clinic, they're writing a paper on you." And they said, "Yeah, that's pretty good deduction."
yeah, when 20 doctors are looking at you, you kind of yeah, they want to
At
know
Mayo
something.
Clinic,
At Mayo
no
Clinic,
less.
obviously, yes. They want to know something from you.
Yes. So it was really an interesting thing for me to learn. I don't know what I can do with it. I'm definitely hoping that it changes the direction of research. Maybe it'll help us later on manage it through our adult lives.
Yeah, definitely.
You know, I'm not as lucky as some that just had the surgeries and never had any problems after that. like you, not lots of surgeries under my belt, and each surgery just makes things worse. It just adds to the scar tissue and all the other issues that come along with it.
Yeah, no, most definitely. I think it's one of those things with Hirschsprungs. I think when talking to so many people that I have with it, it's that everybody is different, and that there are some, as you said, who have had, have the pull through, maybe have one more. Everything is, as normal can be. But then, I mean, there've been people I've talked to on here that have had over 100 surgeries.
Oh
Uh,
my.
yeah, so anywhere
Oh,
between sort of two and I think it was about 140 or something like that. It was, yeah, a lot of surgeries. Um, and then you can imagine those the scar tissue, as you said. The more operations you have, the more scar tissue you have, the harder the next operation is going to be in theory. So, yeah, so that is, it's Hirschsprung's is different for everybody. Hence why I think trying to get stories out there is for the best, in my opinion.
well, I had four as an infant, four surgeries. I had an exploratory in Elkton by a general surgeon. They didn't have pediatric surgeons as much as they do today. Um, he gave my mom a list of things that it could be. And then I laid in the hospital for 3 days. And then my mom came in and threw a hissy fit and said, "You bring a specialist in here or I'm taking her out right now." And they brought someone in from Delaware, a pediatrician. And again, he said, "These are your options." And he had thought I should go to John Hopkins, but my surgeon had gone to school with Koop. So we ended up at Philadelphia Children's Hospital. I had the initial colostomy. I had the colostomy pull back in, and I got a severe infection. And then I had the pull through at right about 11 months.
Okay, so probably a little bit later than you would do now necessarily. So I think now
Well,
it's
most
a
of
bit
them
early.
waiting to 2 or 3 when I was born.
Yes, yes.
Coop was the only one doing the pull through on infants.
Which again, as we said, pioneer of his time.
Yes, yes, yes.
Absolutely.
My mom and dad were really blessed to have good insurance and find really good care for me.
Yeah.
Because as I had told you previously, you're the first person I've ever spoke to that heard Hirschsprung's besides me. I know that there's one in Rockford. One of the nurses told me that they have another lady in Rockford, and she's in the hospital almost every month. Now,
Really?
they don't tell me why. I
No.
can't, but she just said, because I said, there's not many of them. She says, "Well, there's another lady here, and she has a lot more problems than you have." I don't know her age or anything. That's about all I know. We have another lady here.
No, but
So, yeah, I've really kind of felt kind of on an island here.
yeah,
I,
I
I
think
I felt like I'm on my own trying to find my own journey that I don't know where I'm going.
I think that's pretty normal. And as we've spoken before, you can, as I said, I think in other episodes, I wasn't till I was 25 until I met somebody else, and that was just purely by chance because me being a teacher, I was teaching somebody who had Hirschsprungs or has Hirschsprungs, and that was just purely by chance, and that was kind of one of the reasons of doing this was to try and build a sort of community of sorts. I know there's lots of people, do Facebook groups and all sorts, but to try and sort of put all of these really fascinating, interesting, positive stories all together in one place, so
Well,
that
I did have a mother one time call me with a boy, and she wanted to know if he was going to have a normal life.
interesting.
Did I lose? Okay. Did I lose you?
No,
Okay. Um, but I never spoke with her. I just spoke with her one time. I let her know I have a normal life. There's some management with it,
yeah,
but never, that's about all I've had up until just me having you DM me.
Oh, fantastic. Well, it's excellent. Well, if anybody ever wants to know more, there are 42, I think, after this goes out, 42 episodes of people with Hirschsprungs on the podcast. So there's many hours of listening to be done if anybody wants to do that. Um, Another thing that we were going to talk about that you were very keen to talk about was something that's sort of going on about now with you with COVID. Um,
Yes,
and you have long COVID at the moment.
yes.
You are the first person certainly I've met with both Hirschsprungs and long COVID. I think as we were talking a little bit off air, we're still very much in the sort of finding out phase when it comes to COVID. And I personally, I don't think we'll know a great deal for a long time yet. But there might be people listening at the moment with long COVID. How has your life changed or adapted since being diagnosed?
Well, first, let me start real quickly, before I was diagnosed.
Yeah,
Before I
sure.
was diagnosed, I had decided in my very early 50s, I wanted to go into 60 better than my 50s. So I went on a health journey. I went on trying to eat better and I got into exercise. And for the first time in my life, I really got exercise. I was jogging 5 hours or 5 miles a day, 5 to 6 days a week in about an hour.
Wow.
So I was really feeling great. And then I got COVID in September of 2022. And when I went back, and I would tell you, I almost had COVID light. I had some cold symptoms. I had a headache. I had a nose that ran for a week, nothing major. And then I went back to exercising. And when I went back to exercising, I couldn't breathe, and my heart is just trying to pound out of my chest. Now, this is just a couple weeks from me walking all through the city of Seattle and my family tagging behind me, and I could not exercise. And then we went down the road of COVID. The one thing that's the only benefit to long COVID is it's been much easier to handle my constipation.
Okay.
I'm not having much constipation. However, that's not my norm. And even at Mayo Clinic, the doctor said, yeah, that's not your norm. If you were probably normal in that area right now, you'd be living with diarrhea.
Right.
So the fatigue, the malaise, all of that's really just overwhelming. And personally, I'm not sure. Nobody can tell me. Nobody knows. I question if it's not because I have COVID. When you have COVID, or not COVID, when you have Hirschsprungs, I question how well am I processing my nutrition. And if I'm not processing my nutrition correctly, then I have some sort of immunity issues, I would think. Now, this is just my opinion, and I'm not really sure, but it definitely makes me question, all of that.
Absolutely. And I think, again, I don't know. I don't think there's anybody who knows because there's obviously not been any test or not been a lot of testing on it. I mean, you've got to find someone with COVID, then you've got to find someone with Hirschsprung's. I can't imagine there are many people in the world who have both. Um, but I mean, your theory does in terms of being an autoimmune disease, um, such as COVID, and the condition that Hirschsprung's is as well. Um, there's certainly a possibility. I don't think anyone can say for sure, as you said, um, but having COVID and Hirschsprung's is a bit of a double whammy.
It is, except that I'm having an easier time going to the bathroom. But as the doctor at Mayo said, um, that's not my norm.
No,
I should be having to manage constipation, which is most of what I've had to do most of my life is manage constipation. And that can be challenging.
very, very.
Sometimes people forget that just because we had it fixed does not mean we work properly.
No, no,
And I'm totally done hearing doctors say, well, you had that fixed. Nope, wrong answer, because it's not fixed. Mayo's proved that.
no, no, I think that especially when people haven't heard of Hirschsprungs, they can potentially go, oh, well, you've had the pull through, everything's now fine. And it doesn't, again, as we said before, some people that can be sort of true. For a lot of us, me included, it is not. And things it can be sort of you know, things happen daily that are challenging or weekly or whatever it might be.
I had some of that, and then I had no, like when I travel, always bad. The last colostomy, or not colostomy, the last colonoscopy I had, it got me so screwed up. It took me, I think, 6 or 8 weeks to get back on some type of schedule at all.
Wow.
4 days after the colonoscopy, I'm constipated again.
That's yeah, that's
Like, how can I be constipated already?
that doesn't sound yeah, that doesn't sound quote unquote normal
Well, it's
necessarily.
not, but there we
Yeah.
are.
But as we were speaking off air, I don't think any of us who have Hirschsprungs are normal.
No, I don't either. I think that some have it a lot worse than others. I've read a couple of stories of people going back to, some form of colostomy or stoma or whatever. Um, all I've ever thought about is what do you got to be going through to actually sign up for that?
Yeah, yeah, most
I
definitely.
mean, you know, you'd have to do that's a hard sell for me.
Yeah, 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 I understand that most definitely. I think as well, it's something else to touch on. In terms of your life as Hirschsprungs, how have you seen, I guess, the ways in which people are treated change over the years?
What do you mean by that?
But as in sort of the way, because we were talking a little bit about the pull through and the scars being a lot
Uh,
larger than they are now. Is there anything
yeah.
that sort of stands out that you think actually this is done differently sort of over the years? Because obviously you have more experience than a lot of my guests with Hirschsprungs.
Um, I don't know what they're doing today with all of that. Because I'm already so messed up and lumpy and bumpy and so full of scars, they typically a lot of times just reopen old scars.
Ah, okay.
So I don't ever see much difference. Now I've had some doctors be very creative with me. I don't know if you're aware of Hirschsprung's patients tend to have very weak pelvic floors.
Makes sense.
So very early on, I was in my 30s, late 30s with having some incontinence issues, and I had never carried a baby.
Hmm.
And they told me, again at Mayo, that patients with Hirschsprung's, because of all the surgeries they had in the pelvic region, they tend to have a weak pelvic floor. And then what they did is they did a hybrid of the old bladder sling and the new one where they did vaginally.
Okay. Yep.
So I had a little bitty, like 1 inch scar, and then I had stitches come out of my vagina.
Right. Got it.
And that was very successful for me.
Okay.
But it was really shocking for me to start having incontinence issues and not have carried a child. Normally, it's women carrying babies.
Absolutely. Absolutely. But I think that definitely, that certainly from again from people I've spoken to, we're talking a little bit about scars and about how the scars across the abdomen where the pull through goes through just doesn't won't look the same anymore, even from sort of from when I had mine to when people who are having them now, they look sort of completely different, and in a lot of cases, I think a lot smaller.
Well, my stomach's just a mess. It was definitely difficult for me through my teen years at gym class where you changed in the locker room.
Mm.
As an adult, overall, I think I've just handled it. Well, it saved my life. I wouldn't be here without them. They're who I am. And if I don't go through life with some scars, I'm probably had a pretty boring life.
Yes, yes. I
You
think
know, I got other scars. I got a monkey bite scar, and I got other scars that tell stories.
that's true. Every scar tells a story.
It does. Some of them are good, some of them are painful.
Yes, yes, most definitely. But I think, yeah, a lot of us, in terms of Hirschsprungs, we tend to wear our scars, potentially more than most.
Yes, probably. The other thing I did want to cover really quickly, if you don't mind,
Absolutely.
is I want to talk about the parents of the upcoming Hirschsprung's babies coming along. My mom did, I've got a really fantastic mom, but my mom did a few things really right for me very early in my life, some decisions she made. One of them was she was never going to let anyone treat me like a sick baby because I was going to grow up and I was going to be normal. She didn't want people coming along and babying me. She wanted them to treat me age appropriate. And that was really a blessing for me. I didn't know until much later in my life what a special place I had in extended families' lives. But as a child, I just thought I was like everyone else. In fact, I didn't know every other baby didn't have to have enemas and suppositories.
Well, why
It
would you?
never
I
occurred to
guess.
me. Right. Why would I know any different? Secondly, she never told me that she had concerns with me sexually because of the babies prior to my generation were being left impotent. She was always worried about that. So after I'd gone through fertility issues, which is the other thing she didn't talk to me about, she late in my early 30s, she asked me about it. And I says, well, of course I have orgasms. And then she told me why she had always been concerned. And then same thing, the night I had the where the colostomy pulled in and I got that severe infection, that next morning she had a conversation with my dad about I would never have babies. But she never told me that. She let me do it organically. And them were really good things for me. And she's always known that I would have to manage this. This wasn't just a one and done. This wasn't my appendix rupturing.
No.
This is a lifelong thing. She never made a deal of it, but she was always there to understand when I did need to. I was pretty normal through my childhood. Then I had an ovarian cyst at 18, and when they got in there, my bowels had wrapped around and grown to my uterus, which would have been really dangerous had I become pregnant. After that surgery, I really started having to manage constipation more than I ever had in my life. And since then, the more surgeries I've had, the more issues that have arrived, including I have obstructions. I haven't had one since COVID, but there for a while I was having pretty regular obstructions. I call the doctor going, I'm going on clear liquids again. And I would do clear liquids for a week because I don't want to let them open me.
Nope.
That's just going to create more stuff. And every surgery I've had really has been needed. I
Yeah.
didn't, I did look at one point in my 20s about having my stomach, fixed, but it was never really going to be fixed.
What do you mean by fixed?
Flat, not have it so scarry.
Okay. I think there's been probably quite a few people I've spoken to.
Hey, I'm sorry.
And one more thing you want to mention?
Yes. My mom, she never looked at this as a job or as icky or as, sticking her finger up to dilate my rectum. None of that stuff bothered her. She always felt this is what I gotta do to make my baby better. She never once looked at how difficult it was for her or how much more work I was than what an other baby might be. She always just thought about how am I going to get my baby better? And that was really good and positive for me,
Yeah,
even into my adulthood.
absolutely. And then if there's one thing that is sort of a constant throughout the episodes on this podcast, when I talk to a lot of mothers, is that can't thank them enough really for what they do. Um, and there's so many mothers that I talk to that just would do anything. And just such an important role that they play. I mean, all
Yes,
mothers play an important role. I think we know that. Um, but especially when you have a child who is, I don't want to say is ill or is sick or whatever, although that might well be the case, but is certainly going to go through more issues than your average child, I guess.
yes, yes. Like I had a ton of ear infections. It was always a doctor with ear infections. We all have more stuff than people who don't have Hirschsprungs.
That we do. That we do.
Just have more stuff.
We do. That's absolutely true. But it has been a pleasure having you on. Thank you so much for sharing your story, for sharing a unique insight into what life was like for people who haven't experienced Hirschsprungs in the 60s. Um, but thank you ever so much for coming on. It's been a real pleasure having you and chatting to you. Thank you.
You're welcome. It's been an absolute joy.